It is June 3rd. It is a Wednesday. And Chris, you have your work cut out for you today. You don't get to just stand up here and wax expert today. You will be judged.
I will be judged, and I'm glad I put myself out there for this. But before we get started, Joe, first of all, I want to say thank you to Catalyst for what you do for our Chamber of Commerce and for our city. Your messages are getting out there. Today's message, I was at City Hall today for a press conference about just how our city's trying to heal or trying to move forward or trying to listen and pause and really understand what's happened in our country, what's happened in our community. And so I just think it was a really moving moment for everybody to reflect on who we're going to become and how we can be the best. And so I saw a lot of leaders up on the steps of City Hall really caring for each other and trying to do whatever it takes to be the best we can. So I just wanted to share that with you, that I think our community can heal, will heal. And if there, I said this about the COVID response, Joe, if there's any city that has an opportunity to get it right, it would be us. And it's the same thing for this response. Our St. Pete Way, what you and I and everybody else has worked on the last 10 years, it's prime soil for conversations like that.
And I'm going to take your lead on that and remind people watching this that the Catalyst is a social news platform. We want your content. We have a community voices section. I would love to put out 1 to 2 pieces of thoughtful content a day from the community. We have a lot of our organizations, a lot of our individuals doing it. So if you've got feelings, you've got enlightenment, you've got solutions that you feel passionately about, put them in an article and submit them to us, because that's what we exist for, and we would love to publish that content.
I'm glad you reminded people that, and I hope they take you up on it, because that is the St. Pete way, and that's what's working. But let's move forward. So usually at this point, I say, hey, let's start with the numbers before we bring in our guest. But since the guest makes the numbers or compiles the numbers and is the one who really we looked for the real numbers, let me bring in Dr. Choe from the Pinellas Health Department, and then let me do my presentation, and let's see what he thinks about it as well. So Dr. Choe, you out there?
Hi, Dr. Choe. Good to see you.
Welcome. Are you done with your presentation?
No, I'm about to start it, buddy. So you're going to be
nervous. I can see in his eyes. He's very, very nervous.
Yeah, what's Chris going to present?
Well, hey, before I do my presentation, Dr. Choe, just introduce yourself to our viewers or listeners so then they know who you are.
Hey, good morning, everybody. I'm Dr. Uylee Choe. I'm the director of the Florida Department of Health here in Pinellas County.
Great. And you have been very busy, but let's start with what I usually start with, and you're going to grade me on it. Some of it you've probably seen, some of it you haven't. So let's see what happens here. I'm going to share my screen really quick and get started. Dr. Choe, this is our Pinellas County report. This also has other data in it. This is created by the Florida Chamber and in partnership with all the other chambers. We use red and green. Red means it's going the wrong way. Green means it's going the right way. Blue means it's just a stable number. So what we look at here is we always know this number is going to increase, unfortunately. But the two that we've been directing people to is the weekly percent positive. Obviously, this changes on a weekly basis. It has gone up over the last week. It had been on a 4-week trend of going down. So we have we had been excited about seeing that number under 2, and now was getting close to 1, and now we've seen it spike up a little bit. So we in the business community are a little concerned because we don't want to see that going that way, but we understand it. We also have seen, we had a couple days in a row of our average daily cases going down, but now it's gone up a little bit. So we were, trying to track under 20. Our high point had been 24. So to us, these numbers, while they're still very low and manageable, and I'll show you the rest of this, it's still trending, it's still a day going the wrong direction. And we just want to watch that and see if we don't, if we put too many of those days in a way, then there's going to have to be change. Dr. Choe, for this one, we also showed just the amount of unemployed people that throughout this have registered for unemployment. Currently, we have in Pinellas County alone about 64,000 folks unemployed. That's about little less than 16% of our workforce. So we have a lot of work to do. So let me show you one other piece of that 14-day average that we show, Dr. Choe, is we just want to really watch this trending just to see what does it really mean. And we know back up in April 9th, it seemed like that was where we were at a real peak of that 14-day average. We were really excited when we started reopening our economy around May 4th, where we felt like it was heading the right direction. And then we have noticed a steady increase of the amount of cases now. And then we saw it we thought was coming down, and it started to come back down. Now we start to see it start peaking back up around 20. So I'm going to ask you at the end, what do you think? How do you think this is going to play out? But right now, it's still something that I think we should be at least monitoring, managing, and be really concerned about right now. We also then look at the daily average just to get a sense of why we see that 14-day average changing. And you can see with 940, we didn't have a lot of tests to get at 2.3. So we just never know, but we love to see that our numbers are high in the amount of negatives. That means we're testing a lot of folks. And we really like to see that number under that, 1%, 2%. There were a couple of days we had it, but we're still starting this, we see it spike up. And we see these aren't all going completely down, and I know they will never go completely down, but we're still not out of the woods as we think about it. And then we finally look at our hospital bed availability. That seems to be something that's a lot more steady right now, and it seems to be pacing itself where it seems as the hospitals have gotten back in their business, they're taking the beds, but still leaving enough available for folks who might get COVID. The intensive care unit seems to be averaging at around 25% throughout the time I've been looking at it, and our ventilators have been at over 80%. So from our perspective, from a business community perspective, we're managing and watching these things, and we feel somewhat optimistic that we are still able to do it, but somewhat still concerned. So what we tell people, Dr. Choe, is, well, I don't have it with me right now, is we tell everybody to wear the mask. We still really believe social distancing, crowd control, managing all the issues of PPEs that we can will help us continue this on. So that's what I present every day. How did I do? And am I even in the ballpark of how you communicate it?
No, Chris, you did an amazing job, actually. You really focused on some of the metrics that we monitor on a regular basis. The things that you mentioned, the four things that I monitor the closest is case counts, like you're seeing, and the trends for that, the percent positivities. I do take the COVID-like illness and the influenza-like illness and your syndromic surveillance, I think is important to look at as well. Those can be an early indicator of an uptick. And then obviously the hospital bed availability. That, as you recall, that's the whole reason we're trying to flatten that curve so we don't see that surge within our hospitals and so that they don't get overwhelmed. So I think you covered the main things that we monitor, and I think you did a good job. You're doing a great job, as always. But
thank you for that.
I think moving forward, it's just monitoring those trends. So you sort of evened it out by looking at that. I think you did a rolling 14-day average. I think it's something what we do. We look at it at 7 and 14-day rolling averages as well. So you're really monitoring the same real major matrix we're monitoring as well. So great work.
Beautiful. Well, all right. Well, I always like getting A's in class, so I feel like if the doctor gave me an A, I'll take it. But so let's talk a little bit about it. So, Dr. Choe, how you and I've worked on. We met through Unite Pinellas on just equity issues, because we know that the health of our community isn't proportionately, that the disproportionate effect of health issues. So you and I have worked in the community before, but I haven't had a chance to ask you this. Like, what was it? What has it been like in your career to have this kind of thing and you be in charge of a county's health? Like, what? Just give me the overall magnitude of what you felt like you were in when it was in the real meat of it all.
Well, I think it's part of the job. I really do believe in the mission of the Florida Department of Health. It's to protect, to promote, and to improve the health of our community. And one of the big components of that is our epidemiology, our investigations. And really through what we've seen over the last few years in Pinellas County, and really throughout the career, we've had these types of novel infections. Although I would have to say COVID has been one of the more challenging ones. But we've faced things in our communities such as hepatitis A. We had small cases of measles. We had to deal with Zika a few years ago as well. So I think it's part of the job and something that I do appreciate. In public health, I feel like I have the opportunity to really affect the greater community rather than treating one patient as at a time as a physician. So I'm really fulfilled with the type of job this is, and I really enjoy the work I'm doing.
And so do you have any, so thank you for that. And we appreciate what you and your entire staff and department and all the care providers have provided. So I appreciate that. But, when I'm in the state meetings, I see Pinellas County actually did pretty well has done pretty well so far as number of cases per capita and number of illnesses. Do you have any sense of why that is? Like, why has Pinellas done somewhat okay in this, and other communities haven't? Do you guys talk about that? As far as, did we dodge a bullet? Was there something magic here? What was it? Just because we didn't get some super travelers, or why do you think we aren't like Miami, or even Hillsborough is double what we are? So, like, why do you think that is?
No good answer for that. I feel like in the Southeast Florida, they may have had cases a little earlier, so that might have been a contributing factor. So giving us really more time in terms of preparedness. As you recall, sort of the testing piece of it was sort of there was a little bit of lag in the beginning of all of this, and maybe we had that little extra time to sort of gear that up. I know we are continuing to do that, so we've been working well with community partners to increase that access to testing. Obviously, we're still not out of the woods. We still need to monitor the trends, because the concern is those cases could continue to rise. And obviously, with this, the tough thing about this particular virus is that it affects those with chronic health conditions, those that are elderly, a little with more severe outcomes. And I think our focus and our priorities still need to remain with those susceptible populations.
Gotcha. And so help me understand then. Did you ever, at one point, were you ever like just super? I know you're concerned all the time about our health, but was there a point when we weren't able to handle the volume of people, or had you seen us manage everything correctly? Because I mean, we saw other cities where they were bringing in storage, like just really beefing up on it, and we didn't see that here. Were you ever at that point where you're like, we're going to need some help? Or
So a few things. Yeah, we always we hope for the best, prepare for the worst. So early on, we have a great partnership here in Pinellas County. We're just fortunate that we have all these great community partners. The hospitals, we engage the conversations early. Emergency management and county government are very proactive on that. So we've developed a number of work groups, from hospitals to social services, to homeless. We have all these work groups sort of working on these individual populations. So we did make a number of contingency plans for some worst case scenarios. Fortunately, we didn't have to play some of those out. So we're just, again, fortunate to have these partnerships in place.
Gotcha.
Dr. Choe. So, you'd mentioned a couple of other outbreaks. As you said, we were talking about COVID is kind of part of the job. And those outbreaks certainly didn't get the level of press and level of community awareness that this did. And so how does sort of the mental health aspect lay over the physical health when you deal with, things that permeate the society as much as this has?
And that's a good question. Obviously, through this, there was a time we were in quarantine, with a strict quarantine with a stay-at-home order. There was a mental health group actually working on some of this. They did a lot of great outreach and education, making sure that there's access there. But anything that has that profound impact on the community, profound impact on jobs, it does have a correlation with mental health. And in that regard, we've every three years, the hospitals and as well as the health department is required to do a community health assessment. And what's even before all of this, the number one health issue was behavioral health, both mental health and substance abuse issues. So obviously, something that's trying that can put that kind of strain on any community can even exacerbate that issue.
Wow. And now with just the pure issues of our concern with race and the riots or the protest or the concern for our community, mental health is going to be a real issue right now, right? Because now we've got a double stress to ourselves. So so it's something that near and dear to me, as my wife's a mental health counselor as well. So I understand that. But I'd love to ask you another question about. So you and I agree that we have the data now that we need at least to monitor, and and we all understand what to look at now. When we were first getting into this, when we were talking about gates to come out of it, we talked about contact tracing as a piece of this as well. That we'd have to have a robust contact tracing system in place for our country, for our communities. Help us understand, because Joe and I don't hear much about the contact tracing pieces of this. Is it already in place? Joe and I worked on an app with a tech firm in town. Didn't get much traction from folks, but I mean, like, help us understand that part of the gate system. Like, are we contact tracing? Is it working? What needs to happen? Just help us understand that part of the process.
Okay, so basically, contact tracing is something that we've done in public health for decades for any communicable disease. And obviously, to put it simple, contact tracing is finding that positive and seeing who they've been in contact with. We have a specialized unit called epidemiology that does that kind of function. And again, outside of COVID, for really anything communicable. What we've had to do with COVID is that we've expanded that capability. We've recruited more staff into that unit, did some training. Normally, in a blue sky situation, we have about 6 or 7 epidemiologists, investigators. And what we've been able to do is bring in 22 to help with the investigation and an additional 18 to help with contact monitoring. So making sure that the contacts don't develop symptoms. Additionally, I think the states have taken on additional resources, putting more dollars for OPS hires. So we'll be getting some more dollars in the near future regarding that. They're looking at, they've implemented a texting program. And I know they're exploring at a state level different opportunities such as apps and stuff like that.
Gotcha. So in your sense, you see it happening, and because that's the only part when I'm showing that data, I don't have anything to say that we're doing contact tracing, but you feel like we're, as a county, we have the resources needed to do something like that.
At this time, yes, I agree. I think we've been able to amplify the contact tracing piece of it through recruitment. We have a lot of great and dedicated staff really working on that. But as the cases grow and the complexity of the different locations grow, it's something that we will monitor in terms of the need, in terms of our capability to continue to adequately perform that function.
Gotcha. And just a personal opinion, how do you think our community is doing with helping you by being social distant and wearing masks and stuff like that? Do you feel like the community understands what you're trying to explain to people about how to stay safe? Are you feeling like the community is responding?
Well, I think with anything, anything that we can do to keep continuing to reiterate that message, I think is important. The importance of social distancing. I'd love to see more cloth masks out there. I know there's difference of opinion on it, but it's something that the CDC continues to recommend, especially for the vulnerable population, especially in situations where you can't adequately socially distance. So I'd love to see more of that. I would also ask, the CDC has generated a number of guidance to business owners, to schools. They have specialized guidance for each really type of organization or services that you can think of. So I would advise that anyone in those fields really look at what the CDC is recommending in terms of how the businesses can help their employees and really help the community.
Gotcha. So thank you for that. And we do that everywhere we go. And I really do believe our, at least St. Pete members are trying their hardest to show that kind of leadership. So when you look in your crystal ball, because I know you have that on your clean desk there, help me understand, what do you think? I get 2 questions on this, because when I work on the data and I show people the data, every once in a while someone goes, well, what number does it need to be for us to start heading back into seclusion or back isolating ourselves? Do you guys have a sense of like like you just saw the trends, like what will get you guys to say, hey, we're, is it a percent positive? Like what gets you guys ringing the bell going, hey guys, we have got to do something different now? What is that?
I think it's a number of factors, and obviously it's going to be in communications and partnerships with both community as well as at a statewide level. But obviously one of the biggest things that we would have to monitor is the hospital capacity, right? If our healthcare system is overwhelmed, then that is an issue, or if it's heading in that direction. So I think that's one of the first indicators. And then there isn't a set percentage, there isn't a percent case, but I think it's really making sure that the system in itself is capable of dealing with the surge of new cases, especially in the healthcare system.
Gotcha. Love it. Love that answer. And then we've heard in the media just concerns of the bounce back or coming out in fall and winter time, and it's going to be worse or still going to be a problem. How do you communicate when people ask you about what's going to happen this fall and winter? Where does your crystal ball point you?
That's difficult. What's been challenging about this particular virus is we're really uncharted territory. We've seen a lot of experts make projections and models and stuff like that, but I'm not sure if we can mark that as gospel, right? So I think it's really up to us to really monitor those trends on a day-to-day basis to see where we're heading. Some of the models, as you're probably seeing, does show that we may see a second wave in the winter, which would make sense for any respiratory virus. We just see higher numbers in a spike during the winter, but it's something that we'll have to monitor because that in itself and this virus has been acting sometimes different. So I think we just have to monitor that closely.
When obviously in a perfectly closed environment where just stopping the virus was the number one concern, everybody could just stay home until it dies or goes away or as close to it as possible. And the counter to that, obviously, in the real world, is the economy and the stress and the mental health. So, as you've made these decisions, you coming as from the medical side of it, what's been your sort of personal process to have to take the medical data that you're seeing and then absorb in other factors like the economy and even how that feeds into the mental health, because you're obviously balancing two different kinds of health. The more the more conservative you are on one, the more potential you have to worsen the other, i.e., staying locked down longer means potentially worse mental health, and that whole cycle. So what's sort of been your personal journey in the last few months to kind of balance those pieces?
Well, something that we sort of focus out on the public health side. I know it's a word that's thrown out a lot, but the social determinants of health, right? And one of the biggest social determinants of health is economics, right? So socioeconomic factors. Some studies have shown 40-50% of socioeconomic factors are what contributes to the overall health of the community. So it's really finding that fine balance. And I'm not sure if there's that exact answer between that medical safety, the social distancing aspect, and that the long-term effects on the socioeconomic factors. So what is that fine line? And I think from us on a local level to state to national, we're trying to find that fine balance there between those two things.
Okay. And then one last one about, you mentioned it about social determinants, but for COVID, and I don't have it in my data, you've mentioned to me many times that in public health, the minority community is usually disproportionately affected more than the mainstream community. Was that the case with COVID? And do you see that in Pinellas County, that the minority community is affected disproportionately for this disease?
Recent data is actually showing a disproportionate increase in cases, actually, as it pertains to our communities of color. I would direct you, and I think you probably look at, you got some of the data through the DOH webpage. They do have that daily county report. It does have the racial and ethnic breakdown of cases, hospitalization, and death for the county. When reviewing some of the cases, for example, 19% of the positive COVID cases are in the Black community, which obviously is disproportionate with our general population, and 15% of hospitalizations are from our Black population as well. So continue to monitor those trends, I think, is important, and making sure that there's access to testing for really all populations is something that we all need to focus on.
Gotcha. And I guess you've been very helpful, and I know you're very busy, but the one last thing I'd like to talk about is just schools are trying to figure out how to get back into session, and the impact of just bringing people all back like that. What advice would you give our community about the next steps going forward?
I know the school board's working on some plans. There's CDC guidance on how to do that. I think the first thing is just making sure we keep pushing that preventative messaging, right? It's not business as normal. We say this for every flu season, but I think with COVID, I think it's even more important on staying home when you're sick. I've seen too many cases where people should have stayed home. That you practice the general hand hygiene and get your flu shot, because that's going to further complicate it. If you think about it, if you have a second wave during the height of flu season, they have very similar symptoms. How do you differentiate really between the flu and the COVID, especially if we are continuing to see those types of cases during the height of flu season? So making sure that that's there, and then really communicating to the parents, to to the community of what to look for, to report those symptoms to your primary care physician, to the health department if you have any questions. But being diligent and vigilant, I think, is important.
Well, I appreciate everything you've said, everything you've done for our community. Please use the Chamber and the Catalyst report to share any of that information so that we can get it out. We want to be the community that helps you successfully make Pinellas County a safe place, and you're doing it. And we appreciate it. We can imagine how hard and how many days you have worked in a row. Thank you for it, and we look forward to the next report.
I appreciate that. Thank you, Chris. Thank you, Joe, for having me on.
Yeah, we'll see you soon.
Yeah.